funds to support events like this, but we also provide financial support through grants for critical scientific research in the rare disease space. Before we begin tonight's program, all of us at Rare Storytellers would like to thank Dr. Misro and all of our friends here at the Medical College and at Children's Hospital of Wisconsin for partnering with us on this inspirational evening. So thank you. We also have to put a special thanks out to our industry partners at Retrophin Pharmaceuticals for helping us shine a spotlight on these rare diseases, along with our musical ambassador, Trapper Schoepp, as Dr. Misro already mentioned. Trapper's been with us for a number of years. I think, what are we in 3 or 4 states now? You've been performing with us, and we thank you for your friendship and your support of the mission, so thanks. So some of you here might ask, what exactly is a rare disease? And believe it or not, there's actually a definition on that. And a rare disease is actually defined as less than 200,000 patients in a given disease cohort or group, okay? So, unfortunately, there's about 350 million people worldwide impacted by over 7,000 discrete rare diseases. That's a lot of patients. Many of these, unfortunately, have no treatments or little treatment options, and a lot of them have no cures. 50% of these patients are children, and of those children, 35% will not live to see their 5th birthday. So what do we learn? The rare disease patient journey is neither straight nor is it narrow. Did you know, for instance, that these patients go through 2 or 3 misdiagnoses, 7 to 8 different physicians, and it can take up to 5 years to get a diagnosis of their condition? Unfortunately, many patients are left undiagnosed. So tonight, we here at Rare Storytellers are with you to share the narratives of some of these journeys. These are stories of tremendous adversity, but also remarkable resilience. So you're likely here tonight with us as perhaps a future physician, a future nurse, maybe a physician's assistant, perhaps even a research scientist. So who's a student here? Raise your hand. We've got a few. I'm going to tell you a fact, okay? There's 4 people in the history of the world that have received multiple Nobel Prizes. Okay? Marie Curie, Jonathan Breeden, Frederick Sonner, and Linus Pauling. Those are the 4. Linus Pauling's got a great quote: if you're a scientist of any kind, and what's our fundamental goal is curiosity. Okay? Pauling's quote is, satisfaction of one's curiosity is one of the greatest sources of happiness in life. Okay? Our hope tonight is that your curiosity for knowledge that can change lives increased from hearing tonight's stories. Okay, so take that quote with you. So in that spirit, let's begin the program. We're going to open with our Rare Storytellers, Ryan, Friend, followed by Claire and Linda Bebick. After our stories, we'll hear from our keynote presenter, and then close with some Q&A and our Travel Award presentation for Best Poster. So lots of exciting things. So without further ado, we'll introduce our first speaker, Ryan Friend. Ryan is the father of a very special young lady, Adair. And Adair was diagnosed with rare X-linked genetic disorder, and that's called MRX99. MRX99 confronts Adair and her family and others with congenital heart disease, cognitive challenges, and a constellation of physical manifestations. So, Ryan, please.
September 16th, 2016, almost exactly 2 years ago, we were going in for Adair's 3rd open heart surgery. And by this point, we thought that we were the heart surgery experts. So at 7:30 a.m., we said our prayers, we gave our kisses, and we sent her off with the doctors. Not only did we think that we were the surgery experts, we also thought that we were the emotional experts. We were resilient, we were tough, we were practical, thought we had it. But that day, everything just seemed to take longer. Every hour, the cardiovascular surgical nurse would come out and she'd update us on the progress. Getting into Adair's chest, just took longer. Getting her on bypass just took longer. Doing the repair seemed to take forever. So when we started at 7:30 a.m., fast forward to 7:45 p.m., and the surgeon and the CV nurse came out to meet us in the surgical lobby and said, "We're almost done. We're just finishing closing up her chest. You should see her in about 30 minutes or so." So when 8:30 rolled around, the pacing and the praying started. We knew that something was off. And so the CV surgical nurse came out in a rush and said that there were complications. Coming off the operating room table, Adair had gone into cardiac arrest. She had to receive 2 minutes of chest compressions on her newly closed chest, and she had to be defibrillated in order to get her rhythm back. They were in the process of reopening up her chest and calling in the emergency cath lab teams from their homes. That event and the days that followed are the moments that can rush back completely unexpected. It could be a thought, a song, a smell, and the feelings that you're overcome with are almost uncontrollable. Those moments are what we consider to be our PTSD moment. So I tell you all of this to give you a context. The rare journey is a journey that's filled with incredible joy and deep sadness, laughter and tears, clarity and complications. And because we know that sometimes this journey can be about surviving, but what we really want you to be thinking about is moving beyond surviving to thriving. So hey, there we are. I'm here with my wife Melissa and our 4-year-old daughter Adair, who's sitting back there. Adair is our special little lady who was diagnosed in 2017 with a newly discovered genetic disorder. Its name is really awesome. So it's called Mental Retardation X-linked 99 Syndromic Female Restricted. It's a mutation of the USP9X gene. Yeah, we know. The creative people were off that day. So, we already figured out who some of the medical students are, but I want to start this off with a little bit of participation. So again, med students, could you raise your hands? Any real students that are in the room? Medical students, whatever. Pharmacy, perfect. Yes, please. And how about any students at all? How about that? Yes, thank you very much. Okay, great. Go ahead and put your hands down. Any providers, doctors, nurses, therapists, any medical professionals? Yeah, a few? Good, excellent. Thank you. And then anybody else who knows, loves, cares about, or is somebody rare? Any of those folks? Fantastic. Thank you. All right, let's start with an easy story. You see yourself there, kiddo? That's right. We'll start with an easy one. Frontal bossing. So frontal bossing is an unusually pronounced forehead. So there's some cute little pics of Curly Girl before she had curls. When we got home and started doing the typical things, we started to notice that Adair had kind of this unusually pronounced forehead. We went in for some of the initial appointments with the pediatrician, and we remember going in and talking to the pediatrician about her. Communicated that, hey, we're a little concerned. Well, Adair is, we know there's things that are up with her. We don't know what they are yet. But she has this forehead that seems to be unusually pronounced. What are your thoughts on it? We won't have anybody else take a look at this. And unfortunately, the response was kind of a pat answer of, listen, all kiddos have different shaped heads. Don't worry about it. And what it ended up doing to us is it really made us question. It made us think, are we overanalyzing this thing? Or are we looking too closely at this? And ultimately, made us question our gut instinct. So we went home. We did a little bit more research. We looked into things a little bit further and tried to come a little bit more prepared for the next appointment. So about a month later, we had another follow-up. We had a lot of follow-ups after open heart surgery. So in for another follow-up, communicated again, a little bit more back into it, a little more backbone to it. Again, blown off. And that's when we decided to make a change. We knew that for our little girl, we needed a pediatrician that was collaborative. And thankfully, we found an awesome one. She's an absolute gem. She's collaborative, she's thoughtful, and importantly, she's empowering. And so she made a referral to craniofacial for us. We went in and met with the craniofacial doctor, and they were so glad that we were there. After some initial imaging, it revealed that in Adair's skull, her skull sutures were closing earlier. So the skull sutures were all the different skull plates are separate, and over time they close up. So those sutures for Adair were closing really early. And the risk is increased pressure on the brain as the child develops. And they were so happy that we were in, we knew about it, we were meeting with them every 3 months to monitor brain pressure. Thankfully, nothing came of it. No incidents, no surgery, no nothing. We were very thankful. But everybody was so glad we were there. All right, let's ramp it up a little bit more. Hip dysplasia. At the beginning of Adair's life, we had a lot of time to look over the little lady. She had her first open heart surgery at 11 days old, and our overall initial stay was 45 days long. So during that time, you spend quite a bit of your effort making sure that the child is moving, even though they're sedate, is moving in the bed. So you're rotating the sides, you're doing different things so that you're not having any skin breakdown, things of that nature. So we spent a lot of time moving Adair around. We stuck in as many snuggles as we could. And once we began getting her out of bed and doing a little bit of feeding towards the end of the stay, it really became apparent that Adair had a lot of laxity in all of her joints. Hyperextension, things of that nature, and we had the displeasure of experiencing her joints popping in and out of the socket on a regular basis. Should we haven't had that experience? It's real creepy and terrible. So we asked, hey, what about getting a consult on this? Is there any way we can have somebody come take a look? You know, we didn't know. We were new to this. We were new parents. We didn't know how this was supposed to go, especially in this kind of environment. So we asked, and they said, you're here for the heart. We're focused on the heart. That other stuff you can deal with later. We're going to stay focused on this. Okay, but whatever we need to do. But the more we moved her around, got the experience, we were uncomfortable. And so we pushed again. And thankfully, we were able to get an orthopedics consult. We were able to do some imaging of her hips and discovered that Adair was born without a left hip socket. And her right hip socket was very shallow. And so in collaboration with orthopedics, we came up with a game plan for once Adair's heart was well, what we were going to do. Back breaker, hip bracing, and SpicaCast. So you can kind of see that SpicaCast experience there. So that's that one picture is Adair, really little in the hospital, kind of hooked up to all of her lines and chest tubes and things, and then those are her 3 SpicaCasts that she had from 5 to 8 months old. But we came up with a game plan, and that early intervention helped. It didn't keep us from having major hip surgery. Adair did have major hip surgery, and fairly recently. But what it did do is make it such that she only needed surgery on her left hip. Her right hip is well enough, and a socket formed enough because of the interventions that we took early, that she didn't need any surgery on her right hip. And on her left hip, it was about half of the initial thought of what they would have to do, about half of that. So they did a pelvic osteotomy, so they cut her hip bone, repositioned it, pinned it into place, but they didn't have to manipulate her femur at all, which, as this is a good thing. That early intervention was so critical. Fun fact before we move on. So, that SpicaCast there, Adair, in her 4 years of life, has spent almost 150 days in a SpicaCast. There's a cast from armpits to ankles. And you can see that diaper is hiding a little trap door where you re-diaper things. It is an unpleasant and heavy experience. All right, we're going to kick it up one more notch. She's like really crazy there, isn't she? It's good. Scoliosis and tethered cord. So when Adair was in for her second open heart surgery, we noticed that her scoliosis was pretty progressive. It was pretty prominent, and it was very concerning for us. So again, we said, hey, we're already in with ortho. Any way we can have them come back in and check this out? This just doesn't seem right. And the response was, listen, we're focused on the heart. Does that sound familiar to anybody? We're focused on the heart. And anyway, they don't really address scoliosis until a child walks. So no hip, socket. Anyway, so we're going to wait. Thankfully, we had a physical therapist who was an amazing advocate for us. She bent the rules a little bit and got us our ortho consult. Ortho came in, checked things out. Yeah, this is a little concerning. Maybe we should consider some sort of back bracing, something of that nature. But before we get into that, let's do an MRI to be safe. And so a little while later, we did the MRI and discovered that Adair had tethered spinal cord through that MRI. So for those that don't know, tethered spinal cord is a progressive neurological disorder. If gone untreated, it results in permanent nerve damage. It typically affects the bladder function and can eventually lead to paralysis. So Adair had her spinal cord detethering 8 months after her second open heart surgery. For 2 weeks post-op, these are some of those pictures. Completely horizontal to try to prevent cerebrospinal fluid leaks. So 2 weeks flat on her back, and as you can see, she's a pretty agreeable little cat. So mom and dad's backs, however, not so happy throughout this experience. But what we're really thankful about is Adair, while she does have some minor nerve damage to her bladder, she voids early and she voids often as compared to typical children. She doesn't have to be catheterized. See, what happens to a lot of these children when tethered spinal cord goes untreated is they end up having to be catheterized multiple times per day for their whole lives. It's an incredibly impactful thing for a person. All right. Let's see if we can find the Easter egg there. Throughout our journey, music has played a role in the whole process. We sing and dance a lot in our house. Everything from hymns to Pearl Jam, right? Pearl Jam? We love it. We've had Caring Bridge post titles like, "You spin me right round, baby, right round." So I think it's only appropriate that we look to the lyrical genius, Vanilla Ice, for some advice when it comes to dealing with our rare friends. So that, for those that don't know, that's Vanilla Ice. Okay? All right, stop, collaborate, and listen. So let's remember our original groups of people, the med students, the providers, the people in the practice, and then some of those other folks who care and love rare people. So stop. Students, medical professionals, when you're dealing with somebody rare, stop. You have a million things on your mind that you're considering, you're contemplating other patients, things of that nature. This is a good practice no matter what patient you're with, right? But especially a rare person, where the little details, the nuances can make all the difference and can tell you the most critical things. Stop and be present. The people that know, love, and care about rare individuals, stop. So what's interesting is, and I think this is all very well intentioned, there's nothing wrong with this. People want to help people with rare diseases. They want to be there for them. They want to help them. They want to take care of them, maybe even coddle them a little bit throughout their experience. And that's really well-intentioned and good. But stop and realize what you can learn from them. These little souls are such blessings on the lives around them. Stop and engage with them and understand what they can teach you. Collaborate. Students and medical professionals. When it comes to rare folks, the more eyes and minds and specialties on an individual, the better from our perspective. Don't allow, I don't know what it is, don't allow yourself to get caught in, hey, well, this is what it says in the textbook. There isn't a textbook for rare people. Collaborate with other disciplines, engage them, and as importantly, engage the families, the primary caregivers, and the individuals in the conversation. Have them be a central part of the care team. Okay, people that know, love, and care about rare folks. Collaborate, that seems kind of weird. So, being a parent or a primary caregiver to a rare individual is a full-time job. You are thinking about the health of your child every minute of every hour of every day. It can be physically and mentally exhausting. Consider what you can do to help them. Consider how you can lighten the mental and physical load, and for sure not add to it. Listen. Okay, students and medical professionals, are you listening? When you're in the room, we talk about stop and pay attention, but are you really listening? Are you hearing the details? Are you considering what they have to say? What the parents have to say? What their gut instincts are? Are you using that information to impact the care plan? People that know, love, and care about rare folks. Are you listening to the ways that rare people can enrich your lives? This isn't just a verbal thing. All their little hearts can communicate so much information. Are you listening to what their hearts have to say to you? Are you allowing it to change you as a person? Are you listening? All right. Who here thought that the sage wisdom of Vanilla Ice was going to lead us on such a learning journey when it came to rare disease? Right? Amazing. But in all seriousness, though, what we want you to think about is all these different ways, and back to the theme of kind of our family's portion of the talk, what are the different ways that we can move beyond just survival? All of us, move beyond just survival, move from surviving to thriving. Thank you.
So thank you so much, Ryan. Thank you so much. We've done a number of these, as some of you know, and one of the things that Ryan said that is we've heard a couple of times already, and think about it, is it's not in the textbook. And we'll come back to that in the Q&A, but that's certainly something we've heard before. So thanks again, Ryan. Okay, our next speakers, I should say, right, are Claire and Linda Bevitt. So this is going to be cool. Claire and Linda are a mother-daughter storytelling duo, okay? And they're here to tell us about both raising a child with rare disease and having a rare disease. Okay? Claire was born with autosomal recessive polycystic kidney disease and congenital hepatic fibrosis. Okay. So, Linda.
Okay, thank you. Just want to thank Carrie and Harmony for Hope, and all of you who are here today to help us bring awareness to the rare disease community. And if I had to choose one picture to show you that illustrates what it's like living with a rare disease as a mom, it would be this picture of sea glass. Because not only is sea glass something that is rare and beautiful, but it's something that starts out as little pieces of broken glass, things that have been shattered, scattered, and then over time, with being rolled through some rough waves and water, appear on the shore as something sparkling, unique, beautiful, and rare. And I think that when we possess something rare, it's something that we treasure, that we consider very fortunate to have. We put a lot of rare things in museums and hold them in high value. But when you're the parent of a child born with a rare disease, you don't feel so fortunate. When I was pregnant with Claire, I bought a baby book, like all moms probably. my baby's first year of life. And I came across Claire's baby book recently, and I flipped through empty pages. And it reminded me that when you have a child born with a rare disease, you are immediately put onto an entirely different course. Because in those first few days, I wasn't thinking about filling my daughter's baby book with cute little stickers and anecdotes from her first days and her milestone moments, because we were on a fast race to find out what her diagnosis was and how to help her survive. So a 3-ring binder became Claire's baby book, and over the years I filled it with lab results, diagnostic tests, doctor's phone numbers and locations, charts, every bit of medical information that I could find on the internet, which at that time, 17 years ago, there wasn't a whole lot about her disease. And like many parents of a child born with a rare disease, my husband and I were not expecting it, and we were not prepared. We already had a 2-year-old son. This is us with our son Frankie, and he was perfectly healthy. And I was pregnant with Claire in this picture, and little did I know that 2 months later I would be looking at our newborn daughter like this. And so, like Ryan had said, the birth of a child with a rare disease for a parent is simultaneously your greatest joy and your greatest sorrow at the same time. We were so thrilled to have this beautiful baby girl, our first daughter. We named her Claire Irene, and we're elated, but at the same time, we were terrified. And so like any mother, I sent out birth announcements, but I also included an urgent prayer request in those birth announcements. I took pictures of Claire in the NICU, but behind the camera of every photo I took, I couldn't help but think if maybe this would be the last picture I would have to remember her by. Would she live through the night? Would we take her home? Would she ever meet her big brother and her grandparents? Would she celebrate her first birthday and Christmas and holidays? And so the spoiler alert is that Claire is here today with us, and this is a picture of her with her older brother Frankie and her younger sister Grace. And this is why we're here. We're here to tell you our rare disease story, my story as a mom, her story as a daughter, our story as a family. But we're also here representing the 350 million people worldwide who live with a rare disease, and the 50% of them that are children, and especially the 30% of those children that don't live to see their 5th birthday. Claire was born on March 16, 2001, by emergency C-section because she was breached, 6 weeks premature, and probably in a hurry to get good medical care. She was born with a cleft lip and palate, and doctors immediately recognized that something was wrong. She was struggling to breathe, her abdomen was enlarged, and they just felt that something else was wrong. And so tests later revealed that she had large echogenic kidneys full of cysts, an enlarged liver, and pulmonary hypoplasia, or underdeveloped lungs, which is common with this disease. 3 days later, we were given the diagnosis of autorecessive polycystic kidney disease and congenital hepatic fibrosis, and we were told that she likely would not survive. So ARPKD-CHF is a recessive genetic disease. It's 1 in 4 for carriers, like my husband and I, but we weren't aware of that. It affects about 1 in 20,000, but it's hard to get an accurate number because I think many babies today, even with the good medical care that we have, are still not diagnosed, or they don't survive the pregnancy or the delivery. Babies are born with cysts, kidneys just full of cysts, and a lot of scarring in the liver that continues to develop and progress over time. There are biliary tract abnormalities, systemic hypertension, portal hypertension, a risk for cholangitis, which is typically a life-threatening infection, upper and lower GI bleeds. Many children develop renal osteodystrophy because their bones are affected by the poor kidney function. They eventually have kidney failure, typically before the age of 10, go on dialysis, require transplant. Many eventually need liver shunts and liver transplants, and they live those early days of their lives, in the early years of their lives, with a lot of chronic illness, and especially with immunosuppression even after transplant. It's a very broad spectrum of how this disease manifests itself. no children are really affected exactly alike. There's very little guidelines to accurately predict the prognosis and progression, as well as the outcome. Approximately 30 to 50% of the babies that are born with ARPKD-CHF die within the newborn period of the pulmonary hypoplasia, the underdeveloped lungs. There is no treatment, there is no cure. There are some medications that can help with things like high blood pressure and infections, antibiotics and things like that. And because of improved healthcare, more pediatric patients are living into adulthood, and new findings are being discovered as they grow older. So Claire's first 3 years of life were really spent in and out of the NICU. She had failure to thrive. Her kidneys were 8 centimeters. Normal for a newborn is about 5. She had several cleft lip and palate reconstructive surgeries, developed infections. She had sepsis. She had a bone graft on her palate and developed another serious infection. So those first 3 years were really filled with a lot of hospital visits, a lot of labs, a lot of blood pressure checks, a lot of just weekly occupational, physical, developmental, and speech therapy. One of the blood pressure medications Claire was on, and she was on 3, and her blood pressure was still critically high, was minoxidil, and it caused hair growth. So if you're wondering, it works. She was our little monkey for a long time. And you can see in the picture there that how large her kidneys were. She was about 2.5, almost 3 months old at that time. That was before her first cleft lip surgery. When Claire was 3 years old, we enrolled her in the first ever clinical research study, specifically for ARPKD-CHF at the National Institute of Health, and we were thrilled. We were one of the first patients to enroll. And we've traveled to the NIH about every other year since then. We were just there this past summer. And the study, we pretty much stay about 4 to 5 days. She goes through grueling tests, and they had about 120 patients, I think, in the study, and over the years, I think it's dwindled down a little bit. But the purpose of the study was to really identify and define some of the clinical and molecular characteristics of ARPKD-CHF, to identify correlations between gene mutations and clinical features, and identify outcome parameters for treatments. And Claire, they were able to actually identify the gene, the sequencing of her genes, and confirm her diagnosis, because sometimes children have other ciliopathies or they have other cystic type diseases. When Claire was 8 years old, her kidneys began to decline rapidly. When she was 9, she had a bilateral nephrectomy at Children's Hospital here. 2 days later, she received a healthy living kidney transplant from her family friend, Jeff. And it gave her a new lease on life. She grew, she thrived. This is her and Jeff this past summer, and we're going on 8 years strong, and we're really, really thankful for his sacrifice and his gift for her. Over the years, Claire's had about 26 surgeries. I don't know how many hospitalizations, but I've sort of lost count. We never get used to saying goodbye to her in the pre-op room, never get used to seeing your child in the hospital or in intensive care. And with like all rare diseases, there's so many other curveballs that get thrown in. She's had sepsis from a kidney infection. She not only had sepsis, but she had an antibiotic-resistant strain, and so she spent 2 repeat periods in tough time in the NICU, or in the PICU, and came home with a PIC line. She had surgery to correct her renal osteodystrophy in her knees. So there's just so many things that go along with a rare disease that are not on your radar, because there really is no radar with a rare disease. Over the years, yeah, that's when she had sepsis. It'll be 2 years in October when she was here. But over the years, we've been to specialists in Indianapolis, Chicago, Pittsburgh, the NIH, and here in Milwaukee. I've been involved in several organizations for PKD and met parents from all over the world. I serve as a mentor for newly diagnosed parents because they're searching for hope. And a lot of the answers that they're looking for, they don't find, unfortunately, in the hospitals, because all they really want to do is connect with other families. And they want to see pictures of your child who's 16, 17, 18 years old, and that means so much to them. But nearly every week I read posts from new ARPKD parents who are desperate for information and hope. And sometimes these parents are given really critically sad diagnoses. I've talked to parents who were encouraged to terminate a pregnancy because their child had ARPKD-CHF. And I just feel like there's just not enough medical information out there for these doctors or for these families. And it is, it's just frightening and it's isolating and you feel so alone. But there's also been some of the most beautiful moments in our life. And like Ryan said, you feel incredibly blessed and you wouldn't really trade it for anything because it's made you who you are and you feel like you've been given this mission and this purpose. So I wanted to put together just a few takeaways for you as a mom, doing the mom thing here for medical students and practitioners. Just some advice for you. First of all, I would say, you are going to be, or maybe you are already in the trenches with parents and patients at some of their worst times. Give parents and patients a sense of mission and empowerment to be advocates for their child and give them hope. I had some amazing, incredible doctors and nurses in the neonatal intensive care unit who did this for me in the early days of Claire's life when I just felt like everything was crashing in on us. And it's really means so much when a doctor or a nurse turns to a parent and says, you can do this, this is your mission, this is your purpose, I know you didn't choose it, but you can do it. And that means so much. Number 2, your greatest strength can be your weakness and your willingness to see through their eyes. And when I had doctors that sometimes wept with me, prayed with me, asked for my advice about a specific procedure or diagnosis, I knew at those moments that we were a team and we were in this together. And as a result of that, I gave them my complete trust. So don't ever be afraid to be vulnerable, because that will be your greatest strength. Number 3, find out how your patients and parents want to receive information. I'm the kind of parent that I want it all, because for me information is empowering and it gives me something to do when I feel otherwise helpless. For someone like my husband, he prefers kind of a need-to-know basis, and that's okay because everyone's different. But I want it all mapped out. I don't want one more thing where I have to go to the hospital in the ER in the middle of the night and they say, oh yeah, this can happen with ARPKD-CHF. I want to know it all. But that's just me. So find out how your patients and parents want to receive information. Number 4, I know how busy doctors and nurses are. I know how many patients you see a day. I know how stressed you are. I know how sleep deprived you are. But I would just want you to know that when you walk into our exam room, I've waited all day for that moment. I've probably been up most of the night looking at her labs and test results. I've made a list of questions. I haven't slept because I've worried about her anxiety going to that appointment. And I'm thinking of how I can ask you some of the most difficult questions with her sitting there beside me. So try to be patient with your rare disease patients, because it's really hard to be 1 in 20 or 50,000 and not have a diagnosis or not have a prognosis and not have a little sheet of paper that says this is what's going to happen over the course of your child's illness, because we don't get that opportunity. Number 5, living with a rare disease puts you in a unique kind of stressful situation. You're not just caring for a patient, you're caring for a whole family. And I will go home with my daughter at the end of our appointment and explain things to my family and help them understand and cope. I have a marriage that will inevitably be very stressed as this rare disease impacts our relationships, our finances, our careers, our other children, our hopes, and our dreams. 75% of all marriages that have a child with a rare disease end in divorce. And I don't expect you to be marriage counselors, but understand that living with a rare disease puts a very unique kind of stress and strain on the entire family. And look at your patients and families and look for signs of stress, anxiety, depression, and address it, because it's there. You just might not realize it. It can be rather invisible. And mental health is an equally, if not more important component of their physical health. Number 6, without research, rare diseases will always be here. I'm sure you know that. And you are on the frontier of new developments of patient care and research. And I applaud you if you are choosing a career in the rare disease field, because you may not ever see the results of your work, but I hope you always know that whatever you did on that particular day, at that particular time, is building a framework for the next person who may come after you, and someday a child will be cured because of the work that you chose to do and focus on at that moment. And so this is how I see rare diseases, not as something isolated and feeling alone and small, because really rare diseases as a whole are very significant. They make up a large percentage of the population and a medical challenge that demands our attention and our best medicine. The prevalence of a disease should not dictate the level or the quality of care that a patient receives, and yet only 95% of rare diseases, or actually 95% of rare diseases have no treatment or a cure. And so coming together at events like this is so important, and promoting the rare disease community is so vital, and generating funds to give to rare disease research is probably the most critical of all. And together we can show the world that each and every person living with a rare disease is beautiful and precious and unique, just like those beautiful pieces of sea glass on the shore. And I'm incredibly blessed to have one of those rare gems, and I would like to introduce to you my daughter, Claire.
Hey, is that on? Can you hear me? Okay, cool. So good job, Mom. So I'm here to give you a bit more of a personal take on what it's like to personally live with a rare disease. So I remember a lot of what happened in my early childhood, and but I don't ever remember being afraid. Not that not afraid now, but you know, there are those times. But I always try to know that something good is going to come out of this, and you know, try to stay positive and strong and everything. And some of the things that helped me get through that, my family for sure. My sister is in the back, and my dad. My older brother, he's great. So I love my family so much. I'm one of those people who, if I had to pick between spending a night with my entire family or with friends, I pick my family. They're crazy, but I love them. But yeah, they've taught me a lot, and they gave me strength, and they're always super supportive. Another thing is, there we go. I've learned to live life to the fullest. I have big dreams that I know I can accomplish, and I've never seen my disease as something that could get in the way of that, or something that could stop me from pursuing my dreams. I love to travel. The one on the left is me in Colorado, the one on the right is me in California. I love the ocean. I love just traveling is one of my passions. Another thing is my faith. For sure, my faith has been probably one of the biggest, if not the biggest parts of me getting through this. A big question I get a lot is if you could go back and change what you've been through or have a normal life, would you? And I always say no, not by any chance. I'd live this life over 1 million times if I had to. But also music is another way that I deal with this, which is why this is such a great event. A lot of people like me, they turn to music. It's their voice, it's their inspiration, and sometimes quite literally. This was me after one of my big facial reconstructive surgeries. My mouth was wired shut, so I literally couldn't talk. It was Christmas Eve, and I just wanted to go home. My family was at home celebrating Christmas Eve, and a music therapist brought me a keyboard, and I sat there for like hours and just played the piano. Another thing is theater. I love theater so much. It's like my escape, and I can be on stage for a couple of hours and just be someone else in a different time. I've been in many productions, and All my friends and cast members are very supportive, and I love them. This was me in last year. We did Joseph in the Technicolor coat, and yeah, theater is a big part for sure. Also, I love animals above all horses. I got a Make-A-Wish when I received my transplant, and my wish was to have a horse, but we couldn't make that happen. So we went to a dude ranch in Wyoming for a week where we rode 3 times a day, and it was like the most magical experience. 3 years ago, I was actually gifted a horse. His name is Oscar. He's the best. Yeah, we've developed a strong bond, and yeah, I mean, being on an animal like that, so strong, but so gentle, just like going as fast as you can, it's like the best feeling.
And falling off.
Yes. Yeah, I fell off the other day. Another thing I love, and I just try to do it as much as possible, is advocacy. This is me at my school. I arranged a day where I gave a talk about organ donation, and me and all my friends, we raised a Donate Life flag on our flagpole, and it was just a day to make everyone aware and show them how to sign up and everything like that. Also advocating for healthcare. On the left is me and my siblings in Washington, D.C. when I was selected to represent Wisconsin in the National Advocacy Day. On the right is my mom and I in Madison. We go there a lot, and we talk to our senators, legislators about child health care and how we can improve it. Another thing is mentors and friends. That top picture on the left is my friend. Her name's Talia. She's actually the first person I've ever met who is older than me with my disease. I've never met anyone who was older than me, and she's married, and she's a teacher, so that was really inspiring for me. On the right and on the bottom are some other little kids with my disease, and they definitely inspire me because they're the ones I'm advocating for, and I'm their voice, and so it's definitely rewarding to see them and spend time with them. So I just want to end on a quote. My Claire Wineland, if you guys, I know a lot of you know her, but if you don't, you should look her up when you get home. Her story is incredible. Her quote is, "Death is inevitable. Living a life we can be proud of is something we can control," and I think that's so true. And a lot of people kind of try to bypass the whole harshness of the word death, but for a lot of kids like me, we grow up with that word, we hear it in doctor's appointments, we hear it in the background. It's just reality for us, but we don't let that define us, and there is hope, and hope is me and other kids like me, not having great odds, but doing what we can and talking in front of you guys today, and so, thank you.
Claire, Linda, that was just outstanding. Thank you so much. Okay, for our keynote presenter, all of us here today are very honored to welcome Dr. Raul Urrutia. He is the Director of Genomic Sciences and Precision Medicine and Professor of Surgery here at the Medical College. Dr. Urrutia came to the Medical College via Mayo Clinic, where he was Professor of Medicine and Biophysics. He also directed the Laboratory of Epigenetics and Chromatin Dynamics. He did his medical training at Universidad Nacional de Córdoba in Argentina, followed by positions at the U.S. National Institutes of Health in Washington. Dr. Urrutia has published highly influential original articles, book chapters, reviews, and textbooks in many fields. Go Google, probably, you'll see there's a lot going on there. He has also served as a reviewer, editor-in-chief for many prestigious medical journals and has been awarded numerous federal foundation and industry grants. Raul has authored or co-authored over 150 peer-reviewed publications in his field of expertise. Ladies and gentlemen, our keynote speaker, Dr. Raul.
Well, good afternoon, and I actually want to start with this last session by saying that by trying not to act as a keynote speaker, because as a matter of fact, I don't think that's my role. As you will see in a few seconds, I am one of us. I am one of those who are trying to fight a fight that, like all fights, never has an end, to pass it from generation to generations. And it's very important to fight. One of the things that you always see when it comes the day to honor our troops is to hear my social media release on how happy, how amazing our troops are, how much I support them every day for the bravery of being at the front, fighting for us, giving their life, their family hopes for saving our lives. A few days ago, however, I had the chance to visit the new exhibition of the Nobel Prizes at the National Institute of Health. And I thought, we don't think about these veterans very often. And yet, somebody discovered a vaccine for polio. And maybe we defeated polio. Maybe we save more victims than we can save in many wars. This is not to say that I do not honor, as I always do, our veterans, our fighters. But I congratulate all the professionals and all the families members for doing this fight. I will also start with gratitude, because it's gratitude. I mean, Ryan spoke about hope, but the final stop was hope is gratitude. And maybe even the initial step going to hope. If we are not able to feel gratitude, we are never going to be able to be inspired by hope. If you listen to every single person that spoke, the parents, the family, and the children, they express hope. But at the end, they express gratitude at every single moment. Even for those moments where we have to learn those life lessons we were born taught to do. So my gratitude for this invitation, it means a lot to me. I am a father of a kid that died at the age of 9 months old. I am also a father of a kid that was operated of a rare disease. We extracted half of his liver. Thank goodness Nico was cured by that intervention. And we are a very happy family. But since then, we are also remain in the fight for this. And if you want to know more on how inspirational you are, you think that you are here because you are promoting rare diseases. But rare diseases has been the model in which us, the scientists that are doing precision medicine for adults, for a large amount of population, got inspired. Because it was the first time that we were able to see that we could do something. And now we're trying to apply that to cancer, cardiovascular diseases, kidney diseases. In fact, a few weeks ago, a colleague from the Children's Hospital just diagnosed me at the age of 56. I nearly thought I was just in my 30s, but that's okay. At the age of 56, of a rare disease. It will contribute to my death. I know it will. But there is a message there. Wouldn't Hannah be better if that rare disease would have been found when I was 5 years old? 20% of people here have rare diseases. 20%. Some that we can call you the name of that rare disease because we know, and some that we don't know. I tell you that story in another day because I need you all to come with me as an entire village to try to fight for this, to bring this for everybody that is needed. I'm not going to repeat that the most frequent disease in the world, cardiovascular, diabetes, lung disease, cancer, the most frequent disease in the world and in the United States is the rare disease. The incidence of the rare disease indicate that you are more likely to suffer of a rare disease than any other disease that has been ever described. 7,000 exist, and there is only treatment for 5 of them. I have good news. Things are changing. Things are not only changing for those scientists, things are changing because of you. And then we enter in the diagnostic odyssey. And what is a diagnostic odyssey? Well, for those who like Homer, like I did, and you see how Odysseus comes back in his trip and goes and have all these adventures, and the family try to come back. What it shows you is all the suffering. 30 years, 25 years, 10 MRIs, 5 surgeries. People who told you, your kid has nothing, it just looks that way. Others who said, you know, there is absolutely nothing to do. Go, you know. I mean, this is what we call the diagnostic odyssey. What it means is what we go through for 20 years, and we know that it's a very, very arduous odyssey. Since I have gone from this, through this odyssey as a patient, but also as a father, I know very well what is this. So the good news is the power of precision medicine. Precision medicine is to medicine like putting the rock on the moon. It is. It's true. And you will see that in a few seconds. And the good news about this is that 80% of the rare diseases have genetic origins. So if we do have power, precision medicine and genomics medicine, and that is partially the cause, then we have weapons. We are beginning to have weapons. And so what do we do in our center, for instance, in our genetic science and precision medicine? When you have been attended, you have been seen by our amazing clinicians, colleagues, who are the ones who are the partner of you at every single moment, okay? They consult us. We take these machines that are called sequencing, and we take your DNA, we just chop it in millions of pieces, and then after it's chopped in millions of pieces, in reality, we don't know what to do with it. So, we do these supercomputers that are smarter than us, and when we do this supercomputer, we suddenly make this map of you. And we can also make a small map that actually talks you in a disease state. Not only that, if I take a baby who is just recently born, and you give me blood, and I do a test, I may know all the drugs that are going to save that kid or hurt that kid for the rest of the life of an individual. My God, we have to think where we have gotten. That is the moment of gratitude. Where we started from those nights, right? Where we have gotten and where we're going. That's the good news of this. So, I'm the director of the Genomic Science and Precision Medicine Center, and since this was a talk for getting to know each other, I will let you to get to know through a video which was recently released, so that you know what inspired me. And this will speak more than the words that I can say, okay? We have recently, this is the best way that we can fix it. should have been embedded, but you could not embed it, and it is started again. Let's see. Sorry, thank goodness this is a conversation and no the Hollywood project. Can somebody help with this video or not? Can you help me with this? For some reason it's not playing. Okay, now we will go back in the day. I think that I can introduce myself too. No, it's not gonna do it. He was doing it a few minutes ago, but for some reason it's not gonna do it. It's this is what it happens. You have dogs like I do. They always want to do the trick when people are not present.
Actually the poster child of the American dream. I mean, what you see in me is actually the poster child of the American dream. I came to the United States without speaking English and only with $48, and I paid for my ticket working here in the United States. And I raised to the ranks of professors in this beloved and most amazing country where you can actually hope, dream, and make it happen. We like precision medicine because it means that we can diagnose with precision, treat with precision, and prevent with precision. We can today sequence the entire genome of a baby, and that information can be used to infer the medication that that baby will be improved by, or medicines that are going to hurt that baby for the rest of the life of that individual. The first time that I got hooked to this discipline is when I saw a kid showing up on the console and had hundreds and hundreds of seizures a day. And that kid was sequenced, and we were able to find the cause of that disease. To see that science was able to do that, it was a remarkable, remarkable experience. In fact, that day, many years ago, it transformed me from just being a pure scientist looking for truth to a complete dedication to the service of those individuals that this new field of precision medicine is the only one that can touch.
I think that there is a message. I'm not the director. I didn't come to direct the Medical College of Wisconsin Precision Medicine Center because I needed a job. I retired from the Mayo Clinic with 10 years of awarded free money for service given. I also have a contribution from the U.S. government because I work in the U.S. government. I came here with a spiritual search, and it's the same one that you have. So thank you again for the gratitude of being part of it. With precision medicine, we can do better detection in genetic variants that can even be ever thought possible. We can integrate care with entire scientific powers across many disciplines, and what is happening is that now we are thinking about a rare disease that starts with a gene. That's where it starts, right? We all parents know that that's the beginning. And then there is a second problem, and then there is a third problem, and there is a third problem, and a fourth problem. But we have now new methods and new algorithms of precision medicine that may help us to bring to these children and to these adults better opportunities of living a better life. And what we are going is to intelligent information, because now, for instance, we can reconstruct, we can do gene-to-phase reconstructions. For instance, we can reconstruct what type of genes could be candidate for a particular phase. We can do unbelievable things, but we cannot do unbelievable things unless we all of us work together because we still have restrictions in healthcare, return from the investments from medical companies. We have people who do not believe. Some people who say, well, you know, there are very few. There are few. Tell me if my son is few, right? So we have to fight together on that one. So precision medicine and MCU and MCW are leading the way. What we have is currently programs that involve genomics, just when you start to do genomics, but we have added epigenomics, microbiomics, pharmacogenomics, and many other, and artificial intelligence directed deep phenotyping, things that we will be able to bring better solutions to the population that need to do this type of access service or research. So solving the diagnostic odyssey through precision medicine is our major goal. It's the major goal of the Medical College of Wisconsin, and this year has been demonstrated by significant investment from our dean and our president in creating this center for all of you. So if you have any doubts, please reach us at the Genomic Science and Precision Medicine. I didn't want to show you what we can do. I didn't want to show you science. I thought that it was quite silly to show you how I do these unbelievable things and, you know, little tools and how connected together and how can go inside of a kid and what they can do. But are you truly interested in that? Or are we more interested in creating a front, a united front, where we together, bring this, because all of us are rare. All of us are unique. Thank you so much. Thank you. Thank you.
Thank you, Dr. Heredia. It's a lot different than it was 20 or 30 years ago when drug development was walking around in a dark room with a key and seeing what a lock would fit, right? So this is a very inspiring time going forward. So now we've got just a few minutes here for question and answers. At this time I'd like to invite Ryan, Linda, and Claire down to the front if they so choose. In some of these sessions, we encourage the medical students or any of the other students to ask some questions. All the speakers today gave a compelling description of their interactions with physicians and healthcare professionals. And now's your chance to ask a few questions. So if you've got, raise your hand. And while you're thinking of those, I have a question actually. You know, we've done this a number of times, and the stories are different, but they have a common theme going through them, right? So Ryan said earlier about this stuff is not in the textbook. Can any of you or all of you speak to that sort of concept in today's context? In other words, you know, a child or yourself has a condition, and now we've got things like the internet and support groups that you can get together by the internet. And can you speak to some of the pros of that and maybe some of the cons of that side too?
We've been really fortunate. So there's a lot of uses for Facebook, right? But we've been able to connect with around 15 families from around the world, parents of daughters with our daughter's genetic disorder. And so we've learned so much from them, being able to see, I think the oldest girl that's part of the group is like 16, something like that, right? Yeah. All the way to newborns being diagnosed now. And the ability to connect with other parents going through similar things and compare notes about how do you move from that survive to thrive thing, how did you intervene, how did you advocate, what did you do kind of thing has been an incredible blessing for our family. Incredible.
Yeah, I think moms and the internet are powerful. Right? My doctors, our doctors fortunately know me, and I come in with having done research, and sometimes that research is just talking to another mom I met online. But it is really powerful in the rare disease community because it's all we have. And I have brought stories of other rare disease patients, with Claire's disease to our clinic appointments and said, but what about this child? Maybe this is what Claire is experiencing right now, something similar, or even different drug treatments or things like that. But it can also be, I guess, frustrating because sometimes you may get the wrong information or false hope, but I think more than anything, it creates a community out there. There's no one in our town, in our city that has the same disease as Claire. And, we know a few people in Milwaukee, and you instantly feel like they're your soulmates because you're traveling the same journey together. But,
Can I make a comment on this? I actually think that we as community have a unique opportunity. I think that the applications of genomics to rare diseases started here by my illustrious predecessor, Dr. Howard Jacobs as well. And I've seen the science has changed significantly. There is an aspect of science that we don't like, that I don't like, which is called money. No, truly. Truly, because if you say it's a cardiovascular disease versus this rare disease, the reviewer is going to choose to where it's going to choose. So, it is important that, maybe even this is a great place. This is a great place to probably even make the largest organizations of rare diseases. It's known. And in fact, you have the rare disease program here at Children and MCW is the top in the country. So I think that is where the things change. Yeah. Because then we scientists can do what we need to do and we want to do.
I don't know medically how, I've seen it help my mom, and I've seen it diagnose some things that might have gone unseen. But for me, it's communicating with other people with my disease. So Talia, who's the only girl I've ever met who's older than me, like the other day, she sent me a link to better looking medical bracelets and little things like that, or some advice, or if I'm on this specific medication and it's making me have some symptoms and I don't know if it's normal, I can go to her and I can ask her. It's really important for me to have that. So.
Excellent, thank you. Okay, we're just a few minutes over. Any other final questions? Oh, go ahead.
So you said that Claire is became part of one of the clinical trials, so was one of the first patients. Was there anything that your doctors did or said or helped talk to you about the trial that she was going to enter that either helped you kind of decide that yes, this is what you want to do, or what concerns that you had that you really were looking for kind of the doctor to kind of help you answer as you began to enter that trial?
I actually found about the clinical research trial for her disease not from a doctor, but from another mom. So I brought the information to our team and said, would this be helpful? And they were like, yeah, can I make a photocopy? Because they'd not heard of it. But and a lot of the outcomes, every time we go to the NIH, like we were just there in July, and they discovered she had enlarged lymph nodes in her abdomen. And we came home, and a week later, she had enlarged lymph nodes in her neck. And because of those two combined issues, she immediately was brought in for a lymph node biopsy, and they were concerned about PTLD. So it's so wonderful to have that other team. And I've called them, and I feel so close to all of them. I can text them. That's how close we are. We really are. I've sent labs to them, when Claire had sepsis, and can you just look this over and let me know what questions should I ask? So.
Can you please tell us or share what led you? I work at NIH, as you could see before. What led you to go to NIH? Was that the program of Dr. Hall pick and pay for every single thing? Was it something special? Was it a desire to have another option? What took you there?
I think it was really hope.
Hope.
It was hope. And it was the opportunity to learn more about her disease, and hopefully our experience with it will help develop a treatment or a cure. We know that we probably wouldn't see it in our lifetime, but the work that they're doing and what they've discovered, you know, with Claire as one of the patients, she's in their medical journals, you know. I mean, they always send me whenever something's published, they're like, here's what you helped contribute, you know. And I show Claire, I'm like, see that slide? That might be your kidney right there. But it's your thing. We were fortunate that we were able to go and take the time off from work to bring our family. And for the first few years, they paid for everything.
Yeah.
This past year, we had to pay to get there. So it is a sacrifice in that sense. And it's not fun to be in the clinic for her, especially when she was 3, the first time we went. And, you know, people would ask me, why would you do that? She's already going through so much. Like, she's going to go there, get poked and prodded and examined. But, you know, we're part of something great that could happen. And if this is the only research study that's ever done on her rare disease, you know, we're honored to be part of it. And we're happy to contribute to a future of maybe developing a treatment or cure. And there is a clinical drug trial here at Children's Hospital that came out of that study that Dr. Ellis Avner led, and Dr. Cynthia Pan here at the Polycystic Kidney Disease Clinic. So,
for me, the clinical trial, if like medical students, doctors, future, whatever, if like I advise you to look into medical trials, because it's not fun and there are painful tests, but for me it kind of gives me a purpose. And like this summer, I could have just sat at home and done nothing, and which can lead to a spiral of not so good things. But instead, I got to go to the NIH. I got to meet so many people. I met 2 new people with my disease, and the science is it's too late to help me, but it's going to help other people. It's going to help younger people than me, and that's so worth doing to me. So.
Thank you so much. Any other questions? Go ahead.
Claire, I have a question for you. So you're a transitioning teen going into the adult world. What's one thing you want to tell the providers that are here that could be working with teens that are transitioning? What's one thing that they can learn or should keep in mind when they're working with young adults, especially those that are rare?
Yeah, I'd say just simplify as much as you can, because you know I'm a senior in high school and taking classes, also applying to colleges, and the stress of that, and you know, am I going to get accepted? Am I not? On top of that, other kids don't have to worry about transitioning to adult care and how scary that is, and meeting with your doctor on your own. And I met with my nurse on my own for the first time a couple weeks ago, literally just for 10 minutes, and it was like I was panicking. Like it's not an easy thing to do. So I'd say simplify. So I'd say simplify as much as you can, and then also ease them into it as much as you can. You know, don't dive off the deep end. And my nurses and my doctors here have done such a great job of that, and I feel ready, and I can't wait. So.
Anybody else?
I have a question.
Sure. Go ahead.
So this is for all 3 of you. Before your experiences and all this, did you have an interest in science, or like now that you've gone through it, you've heard the terminology, you're always like surrounded by it? Like, are you interested in learning more about it now, or have you, or you guys are still like kind of like just tell me what's wrong and how to fix it?
Right. So for me, I always joke around with my friends. I kind of have a one-up in science class because I know
You know a lot.
I know terms and I know things that a lot of kids don't know. So I'm not good at it, but I know certain things that other people don't know. And for me, I think if I'm not like super sick, I love being here at Children's Hospital, and it's always a chance for me to skip out on school. I'm not a school person. And for me, actually, when I grow up, I want to write and direct movies or act in movies, and I just want to tell my story and talk, do public speaking, and just write as much about that as I can, maybe write a book. So for me, it's just about getting the word out there as much as possible, everything like that.
I don't think you have to grow much more to be able to start doing it.
Yeah, I mean, I love doing this, and I'm trying to get better at it, so.
I was a liberal arts major, and I think I got a D in algebra, so science and math were not my thing at all. I had no experience in the medical field. But when you're thrown into it as a parent, you just soak it all up, and you'll learn anything for the sake of advocating and caring for your child. So my husband laughs at me because sometimes I'll find, articles and journals and research, and, I pull it all together, and I couldn't do it for anybody else but her. So, but I do love it, but what I really love about the fact that, I didn't choose this, we didn't choose this, but it has propelled us into a world of meeting some incredible people, and we've learned things that we never would have otherwise learned, and I've sort of taken more the advocacy role and volunteer at Children's Hospital and serve on Family Advisory Council, and so trying to, give back in that way. So I've found, kind of a love there, but I don't think I'll be practicing medicine.
So, I work in the electrical industry. I'm married to a mechanical engineer. So, math and science is cool in our house, but nothing at medical ever, nor was it ever an interest previous to this, but like a lot of things in our lives, what you're passionate about, you learn. And so, we've become very knowledgeable on that little lady. And so there are times when we're talking with other medical people and you start using terms, they're like, hey, are you guys in medicine? No, I'm just really passionate about my kid. So, no real desire to go that route per se, but I feel like we're more informed to be able to encourage people in their medical journey. And like Linda, I'm really passionate about the advocacy side, about the involvement side, about helping the system out as a whole, so I also help out at CHW on some committees and get to do fun things like this. So it's good when it's doesn't need to be a job for me. I'll leave it as a passion.
Can I just give a little bit of an announcement? GSPMC has opened a new chapter in our life that started with the dialogues with the community, which you were really key part of it, on precision medicine and the community with the Advancing Health in Wisconsin. But the GSPMC is starting a group of people who will send emails and will register, called Friends of GSPMC. And so what it means, Friend of GSPMC, is that Friends of GSPMC almost will be able to bring any idea or send us ideas, or if there are a group of 50 individuals in the world that are going through the same problems, and we can facilitate or raise money, which is never a promise, but at least an aspiration. We want all of you to come and see us. So if you write us an email directly to GSPMC, we will register you as friend of GSPMC. We can also go and help you and talk on places where you are trying to promote this. Certainly it's a good opportunity to be friends in the same goal.
Great, thank you.
Thank you for that. Very, very compelling. I think right now we're going to move on to the last event. I'll remain our speakers to just stand here for a couple of photo ops at the end. We've got our winners of our poster competition to announce. While I walk over here to get the magic envelope, let's have another round of applause for our speakers. Okay, we had 12 poster submissions today, and they were all fantastic. I can tell you that I chaired the review committee. In my other life, I've got a couple of PhDs working with me, and we looked over the abstracts, and they were fantastic. So the research that's going on here is truly groundbreaking, I think.
and it's quite compelling. The three of us got together and we sort of narrowed down the submissions to make it easy. We had some finalists and chose the winner tonight, primarily based on the ability to not only explain to somebody not in the field what is it they're doing, which is very important, but also how that translates into helping the patient. And they all kind of did that, but one person kind of stood at the front of the line for that. So, without further ado, we're Storytellers and Harmony for Hope. I'll ask our founder, Carrie, to come down here and present the Travel Award to Becca Slick for her poster Proteomic Profiling and Enabling to identify disease subtype biomarkers.
It's a big check.
So thank you, Becca. So for the rest of you, there was some refreshments outside. We've got some music, I think, from Trapper for a little bit longer. And once again, we'd like to thank the Medical College of Wisconsin, everybody here, Children's Hospital, our speakers, and all of you for attending. Thank you for coming tonight. It's been a wonderful evening.